My name is Andrew Rampy. I'm a ear, nose, and throat doctor here with the Greenville Hospital System. My group, our group is called Greenville ENT. It's sort of a group of 9 ENT doctors that focus on head and neck surgery. I like to focus on ear surgery. We do a lot of tympanoplasties to fix holes in the eardrum, or surgery to fix chronic ear disease like chronic draining ears. You saw some of that in clinic today. And then cochlear implants, and then other kind of hearing restorative surgery as well. I would say the chronic ear surgeries are probably some of the harder ones that I do. That kind of problem, dealing with that kind of chronic drainage or chronic draining problem from the ear is difficult. You could see all that infected tissue in the mastoid, but the surgeries are difficult and sort of high stress because you're working around important structures, and it's difficult to fix the problems if you have a problem. Like, for instance, if you were to drill into the inner ear or drill into the facial nerve, those are not problems that are easily fixable. You would if you damage the nerve in that way, the patient's never going to recover fully. And so they tend to be kind of high stress surgeries, but they're also. I think one area that will probably be innovated in ear surgery in the near future is the ability to have some stereotactic localization. We do that in the sinuses. We attach a little sensor to the patient's head, and then we use this. We call it a fusion system. You get a CT scan beforehand that's kind of like a blueprint of the inside of the head. You get the anatomic landmarks, and you can see where all the bony structures are. And in the sinuses is especially helpful because you can tell where the orbit is, where the edge of the eye is, and you can tell where the roof of the sinus, which is the floor of the brain, is. The Clemson bioengineering students, I think, have been excellent to have around. I think you guys often, you're very diligent. You seem focused on the right kinds of problems. I think the students that I've had have been good at thinking through problems and identifying potential solutions.